Welcome back, you beautiful Bravehearts. I'm Dr. Daryl Wolfe, and I'm in Ixtapa, Zihuatanejo, and I'm in the Braveheart Nation studios. And today we are doing Real People, Real Healing, and we're going to be bringing Vicky on, and we're going to be talking about frozen shoulder. Now, if I can tell you something, why didn't they call it frozen hip? Why didn't they call it frozen ankle? Why didn't they call it frozen neck? Okay, because understand something. The same situation that's happening in Vicky's shoulder will happen in any joints of your toes, in your ankle. It'll happen in your knees. It will actually happen in your hips. It'll happen in your spinal column. Okay, they'll call it stenosis in the spine. Okay, they will call it a different name for any different joint or any different muscle because they want you to believe, oh my gosh, seriously, Daryl? Yeah. They want you to believe that these are all different conditions. And basically, it's just issues in the tissues. And remember something, the same ligaments, tendons, muscles, okay, all right? Connective tissue is throughout the whole body. Now, whether you want to believe this or not, your actual emotional issues will set up your physical issues. And when you're unable to process emotional issues, you will actually store, okay, different emotional issues in different parts of the body. That's right. And understand this, whether you're talking about Vicky or whether you're talking about Jim or Jill, it doesn't matter. Everybody has, gone all the way through school, gone through many relationships, and guess what? Most people still don't have a hold on their emotions because they don't understand that the subconscious runs 98% of your day and only 2% of your day is in your conscious mind. And the subconscious is not smart and it's not dumb. It is dumb if it has dumb beliefs. It's smart if it's smart. And understand something, okay? And you need to get this. 90%, at least to 95% of all our beliefs are pretty dumb because we went to public schools, we listened to the government, we listen to the medical system. And, I like today, this lady says to me, I did a pelvic show this morning, showing how to do pelvic squats. And she says, Dr. Wolfe, I'm in menopause. Do you think I should take menopausal medication? They want to put me on 3 medications. Do you think I should do that? And I can say is this, because I'm never going to tell anybody what to do. I said to her, well, let's put it this way. Drugs have never healed anything. Drugs only numb you out. And drugs only create more acidity, which creates more crystallization, more calcification, and pulling more calcium from your bones to create more osteoarthritis. And it also causes more scar tissue, okay, which scar tissue is actually beautiful tendon, ligament, muscle tissue, connective tissue that no longer has the electrical conductivity, and there's mitochondrial damage in all the cells. And that's what it actually is. In the cells, you have mitochondria that make the energy for the actual cell, but it gets calcified and it gets constipated. That's right. You cannot be sick or have a physical problem anywhere unless you have constipation of the cells, where the cells turn into becoming a swamp and they're acidic, and you're pulling metabolic calcium in that wraps itself around the mitochondria, and then the mitochondria doesn't spin 2,500 times per second. It only spins maybe 300 to 500 times per second, and this is why a lot of people are sick and can't get out of bed. And if you all really knew what the most valuable currency is on this planet, it's called energy. And as you can tell, I have a lot of it. And the reality is, once you learn how to do a perfect day on an emotional, physical, nutritional level, you don't have any frozen shoulder, okay? You don't need a hip replacement. You don't need a knee replacement. And I'm going to state this right now, and it's a challenge out there to every surgeon and medical doctor, that 95 to 98% of all surgeries are fraudulent and they never had to be done. And the reality is that maybe not Vicky, but the majority of the population believes that you get sick and you can't get well. Well, that's because they put you in hell, because they've taught you, okay, limiting beliefs, and that you need to have them keep an eye on it for you. And that's why you got screwed over. And the reality is this, it's great. Vicky's searching out for something else. And the reality is if Vicky didn't have inflammation, you wouldn't have pain. And understand something, okay? When you actually, in any part of your body, drops down by 15% oxygen and 15% electrical conductivity, that's when pain kicks in. So when you have a certain amount of inflammation, okay, that takes away, inflammation is a flame, and a flame will eat up oxygen. So in the area of Vicky's shoulder, for her frozen shoulder, she's eating up the oxygen in her bloodstream and her cells, okay, by at least 15%. That's when pain, swelling, redness, and stiffness, okay, all right, actually occur. That's right. And if it drops down even more than that, that's when, by 25%, then she'll have bacterial problems. She'll even have fungal problems in the area, and she'll have parasites coming into that weakened shoulder, because parasites feed on the weak. And now I'm going to tell you something. 99% of the population in the United States, okay, have parasites, and that's because they're so weak. That's because their oxygen levels have dropped by 25%. 99% of the population in the United States is running a 25% oxygen suffocation level in their cells, and that means that 25% of the energies come down. And this is why everybody's walking around exhausted. And understand, almost everybody you look at, okay, almost everyone, okay, they have what's called puffball syndrome, where you don't see their cheeks anymore, okay? You don't see, their cheeks are puffy, okay? The jawline is puffy, so they look like a round ball. Everybody's retaining water. Remember what I said about the inflammation? Wherever you have inflammation, you got to bring in the water truck, or otherwise the fire truck, bring in water to dilute the inflammation. Inflammation is there due to the infection and the irritation, because what happens is 99% of the population, when they get a frozen shoulder, they're going to take medication over the counter. Then when it gets too bad, they're going to take it from under the counter. And the reality is that when you take medication, you're actually shutting off the communication, okay, from the pain to your head, your brain. And guess what? The inflammation and the pain is still raging in here. And that's why people that take medication, wherever, it could be frozen shoulder, it's the same condition. It could be in the ankle, it could be in the knee, it could be in the hip, it could be in the spine, it could be in the intestines, okay? It could be in the wrists, it's carpal tunnel syndrome. It could be in the neck, it's torticollis, and it's all the same. And when you take medication, you tell your body to shut up, and you don't feel the pain, you don't feel the inflammation, okay? All right? You might even cut down the swelling, but the reality is now the issue is going to become more calcified, more scar tissue. And guess what? Now you get to have surgery. Then when you get to have surgery, surgery causes more inflammation than anything else you can do. So understand, the whole planet, okay, mainly North America and other, cities that say they're modernized, okay, we are an inflammation nation. And that inflammation is causing scar tissue formation, all the pulling out of the calcium. That's why you got osteopenia, osteoporosis, osteoarthritis, rheumatoid arthritis. Oh my God. And none of these even exist. It's just that something started off and it got worse, and they gave it a bigger name until you have an autoimmune disease, which you don't, because the body doesn't attack itself. You just got a bunch of infection in here creating the inflammation, and your body's trying to get rid of the infection. That's the deal. And understand this. 99% of all of this comes from leaky gut from the large intestine. So I wanted to set the groundwork a little bit before I brought Vicky on, okay? And then we're going to find out a little bit about what Vicky eats, what she does for a living, how long has she had it, did she have it and then it came back, what did the doctors say to her, did she go to the doctors? So you got to play the detective, and you got to understand something. I'm telling you that health is simple. I can teach an 8-year-old to do what I do. So did you hear what I just said? So did I just call myself stupid? No, I called myself awake. And understand something. If you were awake, you would be the best practitioner in the world for you, nobody else. If you actually loved yourself, cared for yourself, and wanted to take massive personal action. And so, first step is Vicky was brave enough to come on. Hi, Vicky.
Hello.
How are you, sweetheart?
I'm doing well, thank you.
So what did you think of that little spiel?
Oh man, amazing. Eye-opening.
Yeah, yeah. And you know what? Here's what we got to do. Everybody, stop thinking that you're stupid. You're not stupid. You went all the way through high school. You probably went to college. You probably went to university. And even if you're a medical doctor, you don't know what I just said. And even most naturopaths and functional medicine doctors and natural health people don't even know what I just said. Did you know that, Vicky? And that's the God's truth. Am I putting them down, or am I calling them up and telling them that we need to wake up, that the government works for an entity and the government has put all the schooling together to screw us all over? Okay, I just want to let everybody know that that's really what's going on, okay? Because remember something, since you were a child, right, Vicky, they told you not to go on drugs, didn't they?
Oh yeah.
Okay,
Say
so
no to drugs.
yeah, say no to drugs, but say yes to big pharma. And understand, the majority of 10-year-olds are on one drug now. The 20-year-olds are on 2, 30-year-olds are on 3, 40-year-olds are on 4, and 50-year-olds are on 5, 60-year-olds are on 6, and 70-year-olds are on 7. Now, do you know why? Because big pharma tells every a medical doctor that for every 10 years, that person should be on an extra drug. And if you don't believe me, then they're lying to you. Okay?
Wow.
So that's the deal. And understand, the human harvest has never, ever taken place more powerful than today. And that's because it's all about transhumanism, everybody. Okay? If they can get you into enough pain, then you'll want a fake arm, you'll want a fake heart, you'll want a fake hip, you'll want to fake everything. Oh, you'll want to have a chip in your head, okay, that can make you smarter and have less pain. So the reality is the human body is amazing, and we are beautiful creators, and that's what we want everyone to know. So let's take it away, Vicky, and tell me your story.
Okay. Again, my name is Vicky. I just celebrated a birthday. I'm 62. Just had my birthday on Monday. And I'm
Happy birthday to you. Happy birthday to you. Happy birthday, dear Vicky. Happy birthday to you.
Thank
All right.
you. Thank you. I'm happy to say that I'm not on any sort of medication.
Beauty.
Yeah, and I'm retired. I've been kind of stationary, and I'm guessing this is probably the reason why I'm having this issue with my shoulder. Not enough activity. Been going to the chiropractor. I've had 2 visits so far. Last visit was yesterday with the chiropractor.
But
And
that doesn't last long, Vicky. The chiropractor is trying to put it back into joint, okay? And understand what happens with the tendons, the ligaments, the muscles. The more inflamed they are, the more dehydrated and the more shorter they get. So he can push it back in. But when you get stressed out or you try to do a movement that cannot handle the force that you're doing, it'll pop right back out.
okay, he's been using some sort of frequencies uh,
Uh,
therapy.
a frequency or shock wave?
It's a shockwave and then also a frequency
Well,
that he
that's
puts.
going to reduce the inflammation. But understand that what are you going to do about the scar tissue? Because you got to understand, this is what happens, okay? Just so you understand. So let's say that this is a healthy shoulder, right?
Okay.
These are fibers, muscle fibers. And no, there's not that much space between fibers, but they're actually not touching. So what happens is there's circulation, oxygen, nutrition, and waste leaving the fibers because the fibers are made out of cells, right?
Yes.
Okay. So now, for some reason, there was a lot of contraction going on in that shoulder, or you did something and you inflamed it. So understand, what happens when you get inflammation or the contraction, the fibers come together tight. Okay. And when they come together tight, we would call that frozen shoulder, because now they're not moving. You know what I mean? Like this.
Mm-hmm.
Okay. Because
Mm-hmm.
now it's like this. And what happens is the more inflammation you get, okay, the more dehydration you get, it feels like there's a knot in your shoulder. Yes or no?
Yes.
So you feel that lumpy bumpy, right?
Mm-hmm.
That lumpy bumpy. Okay. Where do you live?
Texas,
Where in Texas?
Houston,
Where?
Houston, Texas.
Oh, Houston. That's a little too far to, Rami's in, just north of Dallas by an hour. But understand that if you, let's say if you were with me, we're going to talk about what you can do, I promise. Okay. But if you were right here, right now, I would go live with you. And guess what? I would fix it in 25 minutes. I would fix it in 25 minutes, because what we would do is we would go in with cell sonic regeneration and shut down the inflammation. We would fracture the calcium. That's great. That's going to give you relief. But then we go in with my elbow. It's called Wolfe Non-Surgical. I put it together when I was 28 years old. I will be 68 next week. So now the reality is I'll go in there and I will work on you for no more than 20 minutes. It'll be a little bit painful, nothing that you can't handle. And guess what? I'll get you first to go in there and you'll feel this lumpy bumpy, and where you're pushing, it hurts. And then I would work on there with my elbow for 20 minutes and you wouldn't find it.
Wow.
To understand something, issues in the tissues. So what we're going to do is we would pull the fibers apart, bring back the oxygen right away. There's no inflammation now, but it will be tender. If I worked on you, you would have tenderness. You would have tenderness for maybe 5 days, 6 days, you know, like as if you touched it, it would be tender. But I promise you that after 20 to 25 minutes, you'd be able to just move it without any pain. And that's because you pull the fibers apart. This is all it is. I'm telling you right now that most of the body workers out there don't even know it. They don't even know what it is. It's calcification, crystallization, and scar tissue formation. Okay, we fracture the calcium to ionize it, to get it back into the bone with the cell sonic regeneration. We pull the actual scar tissue apart lovingly, because remember, this is what happens to people. First of all, the fibers come together. Then guess what? And then it feels like a knot. Okay. Does anybody know this is how a fibroid and a tumor grow? First, it's just beautiful tissue. Then it gets stuck, glicky, sticky, and it gets inflamed, so it gets dehydrated, and then it starts to shrink, and then you get this ball. The person with the knot in their neck. The person that says they're bone on bone in their hip, they're not. It's just scar tissue and calcification. Vicky, I know you've watched my stuff, but there's a reason why we give a money-back guarantee on the first treatment, that we'll do more than everything else you've ever done in one treatment. And we'll go further than that. And the reality is, if you can get to a Wolfe Non-Surgical Therapist, it'll happen quicker. So let's ask you a few questions, if you don't mind.
Okay.
Now, understand, we can go in and get the shoulder repaired. And then we got to take a look at what is it that you do during the day. Also, Rafa, are we able to actually turn on the other set? And you can bring up the slide that was there before. And then I'll walk over once I talk to her, and I'll show her how to do the clapping, how to do the belly button therapy, and how to do the crab stretch. Can we do it without going off air? Okay, can you get it ready? Okay, how do you like that?
Awesome.
We're in the big times now, girl. Okay. All right, so you'll do it with me. Okay.
Okay.
All right? But you may not be able to do the other things with me, but I'm going to show them to you, and then you'll be able to do them. And I promise, if you do what I'm saying, it will really work. It really does work. And no offense, but that clapper is going to do better than most practitioners will ever do with you, okay? And I'll show you how to do it. Now, that shoulder, okay, underneath, can you feel under your armpit on the other shoulder and tell me if it feels fatty underneath? The other shoulder, the good shoulder. Yeah, does it feel fatty under there?
Yeah, it's fatty right here.
Okay, now go onto the other shoulder No, under, like right where the lymph nodes are, feel that and feel if it's lumpy and fatty in there, that area.
Not lumpy, but fat. I mean, it's just
Okay.
like a
All
piece of
right. Well,
flesh.
there is no fat under the armpit, love. What there is the you've been backing up your bowels. You know the old pooping in the pelvis I talk about?
You kidding me?
Okay. All right. And you can see your arms are swollen, right? For your size, you're retaining water. Okay. Now go to the bad arm and feel underneath and tell me if there's more fattiness underneath the shoulder that hurts.
Well, I see this.
Not that, right in the armpit, love.
Yes. Oh, yeah. Yeah, it's more right here.
Oh my God, there you go. And guess what? Did the chiropractor tell you that? Did anybody talk to you about that? Because guess what? The shoulder that's going to have trouble is the one that has the lymph nodes blocked. Okay, look. Lymph nodes are here. Shoulder's right here. I mean, come on, it's right in the neighborhood. If I've got my lymph nodes blocked underneath and it feels fatty, okay, we got to move that. So believe it or not, you want to do something live today for fun?
Yes, sure.
Okay, we're going to do it. Okay. But before we do that, do you want to talk about some other things? Are you cool?
I'm good. Yes.
Okay. All right. So, how much do you weigh?
150,
What's your height?
5'2".
Okay. So you do know that you need to lose how much?
I don't know, maybe about 10, 12 pounds, maybe. I don't know.
Oh, really? Really?
I feel like if I was in the 30s, it would-
5'2", you need to lose 30 pounds.
30 pounds?
Now, guess
I
why
need to
you
be
took now?
120?
But hold on. If you lost 30 pounds, you'd be a lean, keen machine, and understand you'd be toned. Now, look at. Do you know why you said you only need to lose like maybe 10 or 12 pounds? You know why you said that? Because everybody's overweight. And you get used to looking at everybody overweight. You do know that in United States right now, 96% of the population is overweight or obese. Now, can I tell you something? And everybody, please, I am not picking on her. Go do your homework. And when I finish with Vicky, she's going to understand why the shoulder is going to be a problem to heal. Nobody's picking on anyone. You know what? Just because 96% of the population in the United States is overweight or obese is not my fault. And the reality is everybody thinks it's normal now. Everybody thinks it's normal to be bloated. Everybody thinks it's normal to be bloated after every meal. Everybody thinks it's normal to be in pain and have inflammation. Everybody thinks it's normal to take drugs. So understand that. Now, when I say everybody, I mean the majority of the population. So here we go. So you've got 30 pounds of infection and water retention. Remember what I just said? That if you've got infection, it's going to create inflammation. Inflammation is going to create what? I said if you drop 15% in oxygen, you're going to drop 15% in energy. Ever since the shoulder thing, I guarantee you your energy levels are lower. And that's because your infection levels are higher. What, Vicky?
Oh my gosh. Yes.
What?
My energy level has gone down. I'm like, oh my gosh.
Well,
Is this
listen,
what
I'm going to
62
tell you
is
something.
like?
You don't have frozen shoulder. You've got the domino effect of normal living where you've been pooping in your pelvis, and the weakest joint in the body is the first one to set off the alarm system.
Wow.
So yeah, I'll tell you what, everybody. Why don't you just go to your practitioner and get him to fix your shoulder and find out that you never fixed the problem? Yeah, but that's not true, Dr. Wolfe. You know, I was playing baseball, and then I took a swing and my shoulder came out of place. No, you took a swing and your shoulder fell apart on you because of the infection that created the inflammation that caused the scar tissue formation, so you weren't able to have an elastic stretch, and so you went and did some micro tearing, and that's what you felt. You tore it out. Listen, did you ever chew beef jerky, Vicky?
Yeah, it's been a while, but
you got beef jerky in your shoulder, and beef jerky doesn't give, does it? Because the life force is out of it. You know what? You know, I can move and I can groove. When I come over here, I'll show you. Understand, I'm 68. as of just in 5 days. And understand, or 6 days. I don't even know. Birthdays don't matter to me. They really don't. So nobody wish me a happy birthday. Just wish yourself a happy life. Okay. So I'm going to go over here and I'll show you some exercises that you need to do. But I'm going to tell you something. It's because, okay. If I'll tell you what, to prove my point, if I were to get you on daily cleansing tea, black gold, and had you do the ultimate coffee enema, which will, you do that rectally, and and if it goes in just 3 inches, it goes into the portal vein and helps to detoxify the liver. And if I were to get her to do daily cleansing tea, black gold, and I'm not going to sell her a lot of money. I'm not going to take her money, everyone. So don't worry. We're not setting her up. We'll give her black gold. We'll give her daily cleansing tea. We'll give her an enema bucket, green coffee, and we'll put black gold into the coffee enema, because when you purge the liver today, when you purge the liver today, just remember, we used to do a coffee enema without black gold, and then I had to use black gold because the liver is so full of what? So full of chemicals, heavy metals, and man-made stuff where they're poisoning us like crazy right now because they're trying to dehumanize us. But that's another story. That's another show. And the reality is this, okay? We're going to purge the liver, but we're going to use black gold because black gold will suck up 300 to 400% of its weight in heavy metals, parasites, and chemicals. So that means it's not going to go into your large intestine when you go to poop it out and get absorbed back into your system because you've got leaky gut. And you're 30 pounds overweight, thinking you're only 10 to 12 pounds overweight because you hang around with everybody that's overweight. Okay? I need you to go and take a look at a 1970s beach and see if you can find one person that looks like they're a puffball. You will not find one. Yeah. So because of the seed oils, because sugar has 62 names, and they're all, if you could look at somebody and go, look at honey, there's no sugar in this. And that's because there could be like 10 different ingredients in the product, but guess what? Sugar will be in there 4 or 5 times because you can't even read the name because they're allowed to screw you over, okay? Remember that the tobacco industry now runs and owns all food corporations in the United States of America. Tobacco, the same guys that said and paid doctors to say that if you sucked on a cigarette that had 162 chemicals, it was exercising your lungs. Okay, so what's happened here, and you know it, Vicki, after you eat, you get bloated and you get tired. And, Vicki, do I need to tell you something? Why do you eat? Why do you eat, Vicki?
I eat because I'm hungry.
No, you eat because you're starving. You're not getting nutrients. I've had one blender drink today. I've drank about 3 quarts of nutritional things. And the reality is I only eat 1 meal a day, Vicki. And I got 10 times more energy than you do. And I can teach you how to have 10 times more than me. You're younger than me. How's that?
Well, I got all the products that you mentioned. I have the bucket, but you know what? I have the tea, I have all that. It's
not just about the products. And I will say that I look at it. I've been collecting these products and perfecting these products for over 40 years, but it's not all about the products. The products, people say, oh my God, it's changed my life. That's great. But guess what? You can't change your life and you can't change your reality unless you want to change your personality, which means making different choices for yourself, right? So if I can get you to do the daily, we'll talk about your products too. How's that? We'll go over your products and make sure the ones you've got, we can start with those. But if you did the daily cleansing tea, black gold, and you did the ultimate coffee enema, and we never even touched the shoulder. And if you were to just clean up your diet, okay, we'll talk about your diet in a minute. I guarantee you, we won't even touch your arm. And guess what? You're going to go, oh my gosh, what's going on here? It's getting better. Well, because it's called whole body healing. Your shoulder just went out because guess what? How old are you?
62.
62. Well, guess what? Guess who's falling apart? Guess who's falling apart? And guess who's
Not me.
And guess who? Yeah, but wait a minute. Guess who's believed that she's been falling apart for the last 5 years? She feels there's things going on and she can feel the aging process coming on quick. Okay? All right? Did you know that I had a gentleman call me, and if he's watching, please don't be mad at me. And he is one of the top people in anti-aging in the world. Did you get what I just said?
Mm.
And he called me up 3 days ago for a consult. I'm not going to mention who he is. I'm just trying to tell you that even the people that say they know, they don't know. Because everybody's looking for the medical breakthrough. Everybody's looking for the silver bullet therapy. Okay? All right? You just got to want to do the work, Vicky. That's it. If you want to do the work, Vicky, we don't have to make you take a second mortgage or a first one. That's the deal. You got to want to. Do you love you, Vicky? Do you love
I do.
you? Would you care
do.
for you like a brand new child? And would you have unconditional love for you? Would you forgive yourself for everything you've ever done or everything you're ever going to do, and just know that we're all being screwed over and we've all done our best since we got here, and they made up some BS lie, and the reality is you need to be nicer to Vicky and love Vicky more than anybody else on this planet. That's how you heal. That's how you have a beautiful life. If you don't, would you hang around with you?
Oh, yeah.
Okay, well, there you go. If you would hang around with you, then guess what? There's more than hope, okay? We've got a healing to happen. But most people would never even hang around with themselves because they've been sold a story that they're not worth hanging around with. Is that true, Vicky? Or am I making this up?
I've heard that. Oh, yeah.
Okay.
But I love me.
All right. You love you, girl. And you don't care what other people think. And you know what? You'll get people in your family, you're conceited. You'll go to hell for that one. Really? Okay, so let's just the loving to yourself and try not to let them know you're doing it because they might call the cops. Okay? All right. So what we're going to do is we're going to do that, and I'm going to ask you some questions. What did you eat this morning?
Well, to be honest, I haven't eaten yet.
What time is it where you are?
Let's see. What time is it?
All right. It doesn't matter. So
it's 2:33.
What did you drink?
I had an orange juice with
Bam, stop. Just hold off. Orange juice will put the immune system in total shock for 6 hours. Orange juice is never supposed to be drank by a human. Oranges are supposed to be eaten, not drank. You just whacked yourself so hard, it was worse than a chocolate bar. And the whole orange juice thing is a fake BS, dysfunctional belief system. Go do your research. You just created an insulin problem in your body for 6 hours. You jeopardized your blood sugar. You should have go have another glass of orange juice and go check your blood sugar and find out why it's going right through the roof. Why do you think diabetics, when they go into an insulin problem, they'll whack back a thing of orange juice, and guess what? It's a good way to kill yourself. And these juvenile diabetics, the ones that they're supposedly born with diabetes, okay, that's why they don't live long, because they just get to use their insulin to keep the sugar pumping in. I mean, nobody eats worse than a diabetic, because, and I'll tell you something right now, you are pre-diabetic right now. And the reality is that once you get adult onset diabetes and they put you on insulin, guess what that is? That's a ticket to kill yourself, because now you can take the insulin as much as you need to try to bring down the sugar. So now you go to your doctor and he goes, oh, your sugar's up. Let's give you more insulin. Well, what about you just eating right? If you ate right, you wouldn't have nobody would have adult onset diabetes. I don't care how bad it is. Adult onset diabetes can be turned around in as small as 2 weeks to 3 months, depending how long, how strong, and how toxic you are emotionally too. It's one thing that if I just started the business, but I've been in it for 40 years. So you know what? We've seen it all. You know what? I've had enough time to try out things and see if they work. Okay. So just know this, the orange juice is just not good. You couldn't, You know what?
Mm.
Try to force me to drink orange juice, I wouldn't do it. It's totally poison. Now, did you buy it in a container or did you juice it yourself?
No, I bought it in a container.
Well, then you took the most toxic drink almost from the grocery store that you could put in your mouth. And guess
Wow.
what? If you were more conscious of it, I guarantee you 45 minutes, an hour later, your shoulder hurt more. And you wouldn't even relate to orange juice is good for you. And you know, this is just like, you know what? Start your day with a great breakfast and a glass of orange juice. That is actually a 50-year-old force-fed story. And guess what? Orange juice is garbage. And when it comes in a container, it's all the rotten oranges. Oh, it's so good. And you know what? I'm telling you right now, you just whacked yourself out.
Well, that's what I did. I mean,
Hey,
who knew?
you know
But I
what?
tell you what,
You can't be a
I have
commercial anymore.
I have not had orange juice in months up until today because I was feeling a little stuffy. And so I said, you know what?
Okay,
Let me drink
what
some
did you
orange juice.
eat last night for supper?
I had I had mashed potatoes and chicken fried chicken, broccoli.
Okay, the fried chicken. Where'd you get it from?
It was we were at a restaurant. It was I was
Okay,
celebrating. Hmm.
and it was a fried chicken. Do you know what they fried it in?
Oil?
Con-
I don't know what kind of oil.
canola oil. And the canola oil is GMO. And what did it do? It went in like razor blades and it actually opened up your large intestine more so that you could poop into your bloodstream. How about this one, Vicky? The more you fry, the sooner you die. The more you cook, the worse you look. And guess
Okay.
what? You went out last night and did the all-American meal, okay? It was the meat and potato meal. And guess what? After you did that, you just wanted to come home and just lay on the couch and have a big fart. So no, that wouldn't cause any congestion. And understand, when you take potatoes and meat, potatoes are a starch and meat is a protein, and you put them together, nobody can digest it properly.
Mm.
All right? What else did you eat? Did you have dessert?
No, no, I skipped.
What
I
did you
was full.
what did you drink at the
I had a
restaurant?
margarita. Margarita.
And you had the margarita before you ate the meal?
Yes.
Guess what? With the margarita, if you take one alcohol drink before the meal, you do not digest your food. So that means that the chicken and the potato, but mainly the chicken, is sitting in your large intestine rotting. Because if you drink alcohol before a meal, you shut off the hydrochloric acid to digest the protein. So then the meat gets through into your small intestine and it wasn't broken down properly. You never drink alcohol before a meal.
Mm. I never knew that.
Okay, you're not supposed to know that, Vicky, because you know what? That if you look at the majority of the population doesn't know anything about health. And meanwhile, they went to school for 12 or 20 years and they don't know anything. A doctor goes how long to school? A medical doctor, and they come out and they know nothing about health. Nothing. Nothing. This is an asinine world. Asinine, upside down and backwards. And guess what? I guarantee you, even though you don't believe in them, I guarantee you that as soon as you have enough pain or inflammation, you'll run to your doctor to get some tests to see what's wrong. And that's what everybody does. Everybody's programmed to be sold off by the pound. And that's it. I'm just trying to wake you up because you deserve a beautiful life, sweetheart. You do. This isn't about putting
I
you
do.
down because guess what? We were all there. I'm no better than anybody else on this planet. And I'm telling you that right now. I am no better, but I want a better life than everybody on this planet. So that means that I have to do something different than the majority because the majority are always wrong. The majority of your family is sick. The majority of your family is overweight. My God, you're 30 pounds overweight and you think you're 10 pounds overweight. Because why? Because you hang around with people that are overweight. And guess what? Our mind is always trying to justify us to be comfortable in our belief systems, even if they're causing us to be sick. I want to thank you for being so nice to put up with me.
Thank you for having me.
So what did you eat when you got home? Did you have a snack?
No, that was it. I only eat once a day.
Okay, all right. Okay.
Mm-hmm.
So what else did you drink since, now remember, we're talking, it's going on, you've been up since what, 8 a.m.?
No, 10.
10 o'clock. Okay. Well, for one thing, sleeping until 10, what did you do? Party all night?
Well, I got a lot going on here at the house and I got company in, so just up talking.
Okay, I get it. I
So,
get it. I really do. Okay.
yeah.
All right, I get it. But I'm going to tell you something. Are you able to have fun without alcohol?
Oh, yeah.
Are you able to go to some place and eat food that won't kill you?
Sure.
Really?
For real.
Okay. I'll tell you right now that if you went and, let's say, had Greek salad with olive oil, and then you had the mashed potatoes, you'd be walking away from there not like you were going to blow. And I guarantee you that after that meal, it only took 40 minutes and your waistline was 2 to 3 inches sticking out more. And that's because you have a manure pile down in your abdomen and it's rotting out and it's making bad bacteria that are gassing off, and that's called endotoxin. And what happens is as soon as you get enough infection and inflammation, that endotoxin goes into your blood and it causes leaky brain. Are you foggy? Are you finding that as you get older, you're more foggy or a little bit more forgetful? Because you do have leaky gut.
Mm.
Okay? And I want you to know something, and I'm not trying to pick on you, but you're more than 20% over your weight. Okay?
Okay.
20% over your weight. You have a 50 to 75% chance. 50% chance at 20%. It jumps to 75% chance of Alzheimer's, okay, at 30% over your weight. And this is actually documented.
Mm.
Remember, you're not overweight, you're overinfected and overinflamed. And what happens is you've got what's called tight junctions in your large intestine. They get pulled apart and now you're pooping into your pelvis. Where do you think chronic fatigue comes from? Where do you think fibromyalgia comes from? Where do you think 99% of all illness comes from is the large intestine being dysfunctional? And your doctor will never tell you that. And guess what? I know your shoulder's bothering you now, but it's mainly your abdomen, right? That usually gives you problems when, cramps, gas, bloating, right or wrong? And your low
That's
back.
true.
And your low back, right?
No lower back problems, but it
Good,
definitely
good.
bloating. A lot of
Okay.
bloating.
Well, remember, every time you bloat, you're pooping in your pelvis. Every time you bloat, you're creating bad bacteria. And people that bloat, you're not going to like this. Bloating comes from having 75 to 85% bad bacteria and only 25 to 15% good bacteria. And you're supposed to always have 85% good bacteria. Let me give you a little lesson. Your bacteria actually will communicate, okay, already 9 times more to your brain than your brain communicates to your body. Your bacteria, when you're bloating, that's when you can't sleep at night. That's when you have nightmares. That's when you're restless. That's when your emotions are all over the place. That's when you feel anxiety. That's when you don't have clear vision, your blurry vision. That's when you have your brain fog. Okay? That's what goes on. Okay? All right? How we doing?
All right. Good. It's just.
And you bloat almost every meal, every time you
Oh,
eat.
yeah. Yes. Every
So
single
I
time I
just
eat.
want you to know that you are not going to be well. Okay? You're 62. By 68, what? Okay, by 68, it's not going to be a good situation. And you know what? And people will be right now saying, you're not very nice, Dr. Wolfe. I'm telling you the truth, that within 6 years, you're going to be hobbling around. And that's it. So I could have said today, let's just do your shoulder and do nothing else. Or I can take the time and give you what you deserve.
I appreciate that.
Here's the deal. If you think you can handle me, which most people can't, if you can handle me one more time, what I'll have you do, because I'm gonna cut to the chase, and we'll do a part 2 with you. Okay? That's two consults, but I'm gonna give it all to you, girl. And then you can put it in the garbage, or you can say, you know what, I'm going for this because I deserve it. And what I want you to do is I want you to download. Did you download the Perfect Day Guide, pdgfree.com?
Yeah, I've got the app.
No. pdgfree.com. That's this. See this book? Okay, right here.
I can't.
Okay, can we get the camera on?
Okay, there you go.
Can you see it?
Yes.
Yeah, that's called the Perfect Day Guide, and you can download it for free. Right now we've got, let me see, about 40 copies left because we put it on sale, half price, in Australia, United States, and Canada. Well, anybody can buy it, but for $48, we deliver it to your door. It's a 600-page manual, and it's got everything in it to how to fix yourself from the nose to the toes. I want you to go in here and read how to reverse the irreversible. I also want you to go in and read whole plant-based keto diet. I want you to look it over. Okay? I want you to read Vaginal Infusion, Ultimate Coffee Enema, okay? Daily Cleansing Tea, Black Gold, okay? Just that. And I want you to take a look at it. And then if you want, you can come back on. And all I'll do is build you a perfect day lifestyle, nutritionally, emotionally, and physically. And then what we'll do, you can do whatever you want from that. If you decide you want to, okay? If you don't want to, I get it, okay? You know, most people right now would probably want to run for the hills, okay?
Yeah, I'm not running. Okay, so you said PDG.
I'll go really slow, sweetheart. pdgfree.com.
Okay.
And then I said, take a look at Daily Cleansing Tea, Black Gold. I'm giving you just the bare bones because that's where we start. You don't throw everything at somebody. And then take a look at Vaginal Infusion. And then take a look at the Ultimate Coffee Enema. Okay?
Okay.
And then if you want, we'll come back and we'll do the diet. Okay? Just know that I'm only here for a little bit more than a week. And if you want to do this, you can research it and then come back to me. Try to get back to me by, what's today? Get back to me within the next 1 to 3 days, and then I can fit it in because I'm off to Puerto Rico. I'm going to be going there to teach a group of medical people how to actually pull fibroids and tumors apart. Okay?
Oh, wow. Okay.
Yeah. And then I'm going to Florida to Jim Gale Food Forest Abundance property because we're opening up a World Healing and Training Center just about an hour and a half out of out of Orlando in St. Cloud, Florida. Yeah. So if you want, you let me know and we'll do that. Okay?
Okay.
Now, if with everything I said, would you like to ask me a few questions before I go over and show you a couple things?
No questions. I mean, I have the daily tea. I have the black gold. I have all the stuff. So
okay.
I just need to use it.
Then I'm just going to walk over to the other studio, okay? It'll only take me a second. It's not like it's that far, okay?
Okay.
All right, love?
All righty.
Oh, and by the way, if anybody has any questions, we are on live. Just put your questions on here. I don't see any so far. So what supplement gives you bacteria since most probiotics are fake? Well, first of all, I don't do any probiotics, okay? They just don't work because they're alien. What we use black gold. That's why I told her to get on black gold. Black gold will actually go in and pick up parasites. It'll get rid of them. Parasites, fungus, heavy metals, and chemicals. But when it gets, and it locks it down, guys. But when it gets to the bowel, the only good bacteria is mummy's bacteria. That's right, mummy's. You could only have one and you'll get trillions if you do black gold. Black gold will come into the large intestine and the bacteria feed off of it. But what you have to understand is black gold will change the environment in the large intestine because of its ability to absorb. And then the daily cleansing tea that I told her to take, that will actually cleanse all her detox organs, her large intestine, her liver, her kidneys, okay, all right, her blood, okay, and her lungs. And it does it without stimulants, without laxatives. And the daily cleansing tea should be taken twice a day. Some people only do it once a day, but if you do it twice a day, it's really gentle. It tastes like iced tea. You can do it for a lifetime. Would you rather just gently clean every day or back it up and have emotional, physical toxicity problems where you're trying to run to the rescue because you're a 911? And that's what everybody does. They wait until they're full of it, and then they're in trouble. And the reality is, I created a program called The Perfect Day, and what I'm doing for Vicky, I would do for people. They would call. I'll do a consultation. They get lifetime support from me. So you get to learn everything, and I get to learn about you. I get to learn about your personality. And we learn to be patient with each other and gentle so that we can actually get there. And you have to be, we have to be respectful because nobody has ever went to school to be taught how to look after their beautiful body. God-given body, that is. Okay, I'm going to come over here and we'll do this. All right, so here we are. I'm over here now. Okay, so the first thing that you should always do you have a belly button therapy kit?
I don't have that.
Okay, this here, when you do belly button therapy, okay, you put it in your belly button, okay, and you're gently going to do this. You're going to do it this way, then you're going to do it this way, then you're going to come over to the shoulder, do it, and then you're going to go to the side, then you're going to go from down here and do it, and then you're going to go from the bottom and do it. Remember something, girl, if you're bloating, what do you think this is going to do for the bloat? I guarantee you it is going to stimulate the good bacteria, and do you know what else it does? Guess what? When you do belly button therapy, you kick your body into the parasympathetic state out of the sympathetic state, and now you're resting, repairing, and digesting. When you do belly button therapy, you throw your whole abdomen into complete digestion of your food just by gently doing this. Wow. You also release more dopamine, more oxytocin, more serotonin, more endorphins than making love, than being happy. That's what this does. Okay? All right? And then we're going to come over and then we'll do the same thing like this. Then we'll bring it to the side and we'll do this. And then we'll come down and then we'll end where we started. And this all comes in, the instructions are there. This is worth its weight in gold. Okay? I have people doing this when they get emotional. I have people doing this before they get out of bed, because when you do this, did you know that your stretch? Okay, if I had you do this right now, and you had this, and you did it for 5 to 7 minutes, easy, and you can do it with your shoulder, guess what? You'd be able to lift your shoulder up more without pain. Just like that. Because of the release of the dopamine, oxytocin, serotonin, and endorphins, and putting yourself into a healing state. You can believe it or not. And then if you end up getting one of these, you come on the next show, okay, and then you tell people that, you know, I was wrong or I was right, because you'll have a 20% more stretch in all your joints because of the release of these hormones and chemicals. People don't realize that. So I want you to do that first to put yourself in a healing state, okay? And then what I'd like you to do, okay, is take the clapper, and I know you're going to go, but it hurts already. And then just do this lightly. Look at it. Not even hard. You can't even hear it. Now remember, you can't do it through your clothes very well. I'm talking about me. Now, after, you know, 3 to 5 minutes, you're going to now that's the bad shoulder, right?
Yes.
Let's work together. Let's go a little harder. Now what we're going to do, me and you, we're going to clap here. I'll talk and try to keep people entertained, okay? Because people get bored really quickly today. So we're going to clap harder. Listen. Clap that. Now clap where the knot is. Right where the knot is, clap it. Do you hear me clapping?
Yes.
Now, I'm going to tell you something. Keep clapping while I'm talking, love. So here's the deal. Everybody out there has been taught to run away from pain. Did you ever notice that the people that run away from pain and the people talk about their pain all the time have the worst pain in the world? They're focused on the wrong thing. We were created by God Almighty. And understand something. What you focus on, you get. You don't get what you deserve. You get what you focus on. So understand. Don't go around keep telling people my shoulder hurts, my shoulder hurts. You want to take massive action. Now, when we get the show done here, feel free to call me, okay? 469-861-8884, or just use the 800 number, extension 5, and I want to share a couple more things with you, okay? If you want, okay?
Okay.
So, believe it or not, really give it a good, keep clapping it. Now, if you were to clap for about 10 minutes and you get more aggressive on this area, okay, what will happen is you know when you've clapped enough, because you've got issues in your tissues. When this starts to go like purple or even blue, black, you did no damage. You brought the infection and the damage to the surface. Okay. Do you ever notice, you must know this, did you ever have anybody in your family go, I went to bed last night and I got up and I didn't even bang into anything and I had a bruise on my arm or my leg or somewhere? Anybody ever say that?
Yeah, I've heard that.
They're the walking dead. They are actually the walking dead. They are actually rotting out, their tissues are rotting out in their body. Where the bruising is happening, that's actual tissue rotting. Like they're actually alive and the tissue is decomposing. Well, what else would it be? Okay, I'll come along with you. Now, most people are taught to run away from any type of pain. Oh, this must be awful. You know, you got to get to a point that when you do this, oh, you feel it, but I'm not my pain. And understand something. What does everybody look for? Pain management. Do you want your pain managed or do you want it eliminated?
Eliminate it.
Well, then you have to take massive personal action. I think you're clapping, I think you're clapping too fast and not hard enough. Okay? Look. Right on it. Go slower and be more focused. And I'm going to tell you, if you do this 10 minutes, see, it's not hard enough, love. How does that feel?
You can't hear that? It's pretty hard.
Go harder. Now, I know that the world has been taught that this is abusive, but this is not abusive. This is called caring for oneself. And, okay, you've been doing it for a couple minutes. Now, have you ever done it this long, this hard?
No.
Okay, now let's just, I could be wrong. Are you hitting right on the spot, though, that usually hurts?
Yes.
Okay, now put that down and then move your arm just the way to create pain. Tell me if it hurts as much.
Oh, my goodness.
Help me. Well, how does it feel?
It feels much, I'm able to lift it a little higher.
Okay,
than what
I'm
I've
going to
had.
tell you something. If you got your Braveheart goddess out and you did this, watch. And you did that, but it's okay. Guess what? With each day, you're going to go deeper and longer and stronger, and it's not going to bother you because psychologically, everybody's thought that if it hurts, stop it. Yes. Don't push through the pain. That's wrong. We're not pushing through the pain. We are mastering the pain. Listen, I'm 68. I have no pain. Do you understand? I have no stiffness. Look. Okay, give me a full view. Give me a full body view. Can you, well, what's going on here? Come on. I want to show you my flexibility, not to show off. But listen to me, Vicki. You can have this as well. I'm going to show you how to do what's called the crab stretch in a minute. But, Vicki, there are 4 exercises that every person should do your age in the morning, the afternoon, and the evening, especially if you've got the day and you're not working. But you always want to do it morning and night. So you can believe it or not believe it, but I usually wake up, you know, if I wake up even just slightly, do you know what I do? I get out of bed and I go and I do my exercises for 45 minutes, no matter what time of the night it is. I'm telling you, for me, I'm rocking my world. Okay, can you give me a full view, please? Okay, so Vicki, I'm going to show you, if you start doing these squats, you're going to help your pelvis heal. Okay, the first one is, and if you can't do it, just watch me. Okay, and when you go to do the squat, Vicki, you'll grab a table or a chair. You can put your hands on a chair if it's too much. Just first watch me. Okay, so what you do is you come down, put your hands on the floor, and the closer your heels are to the mat, the more flexible you are. Remember something, when you lose your mobility, Vicki, you lose your life. And how many people your age are waddling? How many people your age are walking like a stick? Okay? And then you come like this, you put your hands in the front, and then what you do is your armpits are almost by your knee. They may not be right now, but the goal is to go there. No matter what you can do right now, Vicki, that's beautiful. You don't try to be me, you work on being you, okay? And that's it, inch by inch. And you connect to the lion heart breath, 4 seconds in, 6 seconds out, and you focus that your spine is stretching, and you'll feel it stretch. And you focus on breathing 4 seconds in, 6 seconds out, and breathing into your spine and your pelvis, and you'll feel your pelvis start to sink closer to the mat. You'll feel your heels come closer to the mat. The more further off the mat your heels are, the closer you are to a cane, to a walker, to a wheelchair, hospice, or some nursing home, okay? All right, and that's the truth. So that's one. And then the next one, it's similar, but we'll spread our legs just hip length, and then we'll come down and we'll do the same thing, okay? And you can put your hands on the ground, and then again, your knees are close to your armpit as much as possible. And now we'll do the same thing. That's it, but it makes a difference. Now, the reason why we're doing this one, and guess what? This is not an exercise. This is how you should do this instead of sitting in the chair and watching TV, or you're waiting for someone, or you're on the phone. Put the phone on speaker and see how long you can stay like this. Okay? And understand, this is the normal way to poop. So if you got to put your feet up on your toilet bowl, that's the way you do it. Because as soon as they invented the toilet, we put our legs together. Look at, we did this. We put our legs together and we jammed ourselves up, and we're trying to squeeze the poop out. Now, we all know that you can poo way better with your legs spread. So we did the second one, and the third one is like this. And you're not going to do this one. You can just watch right now. Your elbows are in here, and eventually you're going to be like this, and you're going to straighten up your back. You look forward. You can pick a spot on the wall and just breathe and keep on picturing your bum getting closer to the floor and your spine stretching and your pelvis opening. I'm telling you right now, if you've got prostate problems, if you've got an ovarian cyst, endometriosis, bladder infection, if you've got bloating, you got bowel problems, you can't poop right, this is what everybody needs to do this. If you practice those three times a day and be very nice to yourself, don't push yourself that you're going to feel like you're going to tear something, because remember what I told you, you've been pooping in your pelvis, the infection created inflammation, dehydration of your tissues, and you don't want to rip that beef jerky, so you want to breathe and relax and put love into the area. Wherever it's hurting, breathe into it and send love to it, and I promise you, you'll have a breakthrough. Now, I want to show you the main one for your shoulder, and I want you to do this, and I don't want you to push this. Okay. Let me first show you where I'd like you to get to. Once you get to here, you will never have a shoulder problem again, ever. I put this together for my, okay, so right now we've got approximately 5,000 Wolfe Non-Surgical Therapists throughout the world. When they do therapy, they use their elbows, so they're always going like this, so they can get neck strain up in here. So understand, I can show you how to open up your shoulders, unbelievable. I put this together probably 20 years ago, and it's called the crab stretch. I'll show you. So you put your feet out like this, you lift your bum up, you're up, and then you just have to do short. I always do about 20 of these, you know, just nice and short, really just moving that. And then guess what? Once we've done that, we move forward. See how my arms are straight? And only come to where you feel, if you feel pressure here, you stop and you drop your butt. And then you bend your arms. Okay? Now me, I'll show you. Watch. Okay? And then what I do, after I do that, then I do this 100 times. Okay? Now if you can only go to here, you can bend your arms, and all you got to do is this, watch. You see how I put the weight? I got to go a little bit more. I'm so loose. Okay, you got to go enough that you feel the stretch. Now see how I'm just like this?
Okay.
Don't put any pressure. Just no weight. Just there and breathe. Lionheart breathing. Okay, and then guess what? If it's my bad shoulder, let's say my bad shoulder was the right one over here. Okay, mm-hmm. I'm gonna straighten out my bad shoulder over there, and I'm gonna do this. Just with this one, just a few of these. But let's say that this is my bad shoulder.
Okay.
I'm gonna straighten out my right one, and I'm gonna just do this slightly. Look at, just slightly. Look at this, real slow. And you don't do it that it hurts, you just do it to the point that you're feeling stretch. And guess what? Do that a few times and then just rest back into it. Eventually you'll be doing this like this. And me, I put pressure. I pull back, look. I can't even rip myself out, look. Okay, I'll just go up and down, and I'll do 100 of these, okay, when I do. You don't need to, even just do 5, that's enough for the first time. Even 3. 1, 2, 3, and then just stay there and hold. Now, do you ever get like, you get tight in your neck, right in where your neck meets your shoulders? Yeah, right here? Mm-hmm. Guess what? All you got to do is this, look. Roll your neck like this. And guess what? You're going to actually be working on that knot in your neck, okay? All right, and then when you're done, you put your legs up like this, and then you drag, and then you just go and shake it out.
Now I should be able to do that even though my shoulder is...
Okay, listen to me. You're going to be able to do it if you actually clap for 10 to 15 minutes. You know, if I were to get you to actually clap that shoulder, like really, like... well, the clapper's over there, it doesn't matter. But, you know, if you did it with your arm, you're going to get neck problems. So that's why you do this. But if you were to clap that thing for like a half an hour, You know what you'd probably do? Call me up and go, I don't even think I got it. And then guess what? The next day you clap it again. And you clap it for a few days. And then when you're done clapping it, what do? You have DMSO gel?
I don't.
Okay, well, you get DMSO gel and you get DMSO rose cream. Now,
Okay.
DMSO gel is much stronger than DMSO rose cream.
Okay.
DMSO gel, you can put it on and you'll go, oh, yeah, that feels warm, that feels good. And it's made from pine trees, okay? Thank you so much, Adrian. So here is DMSO gel. It's stronger, okay? It's the stronger one. And you only take a little dab on your finger and you just put it on that little area. And you know what you're going to do? You're going to go, oh my God, oh my God, I can't believe this. DMSO is a solvent. So after you've been clapping, you've brought in tons more circulation, haven't you?
Yeah,
You know
it's a lot of heat here.
Well, listen, baby, bring the heat on, because now you're feeling more relaxed in there. Remember, before you would have heat, but that was a blockage heat. You don't want a blockage heat. You want an increased circulation, increased oxygen heat. Remember what I told you? If you can raise your oxygen levels back up, you'll heal the arm. Okay, that's the deal. So we got the right heat, okay? So after you clapped it, you'll take a little bit of the DMSO just on the tip of your finger, and a little bit goes a long way. Put that on. And then just after a few minutes, then you take Pain Away essential oil. Now the DMSO you could put on there 3 to 5 times a day, but the essential oil, you're going to put that on every 15 minutes. Guess what? We'll prove to everyone that with clapping in 3 to 5 days, we've healed your arm, girl. Now, we wouldn't be able to do that with everyone, but we can do it with you. Do you know why? Because you're a bit of a Braveheart goddess. Most women and most men out there today, and please do not take this wrong, but you're victims. The only virus in the world today is victims. Everybody can't stop talking about what's wrong with them, what drugs they got to do, why nobody fixes them, what they can't have in their life. You know what? It's like this. We complain about this, and we complain about that, and guess what? The world doesn't owe you anything. You owe it to yourself to show up and grow up. Okay? Not talking to you, girl. I'm talking to everybody out there that is willing to take a look at a different way. This is called the rose cream, and it's gentler. Okay? So they're not expensive. They'll last forever. They don't go bad. They don't go bad. And you know what? Where are you going to find, this is called Pain Away essential oil. It's a pure essential oil. And this is 4 ounces. We sell it for $95 US. Can you believe it? Wow. You're not going to find that anywhere. All right? And start using my essential oils and you'll see I carry the best. Okay? I carry the best of everything. And if you can find something better, I'll get rid of that and I'll do something new. So what do you think?
I love it. I'm going to be doing this.
Okay, but the way you're clapping right now is Inky Dinky Schnitzel House. So no, it's okay. That's okay. Even just lightly doing it, you know what you're doing? Guess what? How did it feel when you fell in love with someone and they didn't give you any more attention?
Not good.
Okay, well, guess what? That's the way everybody lives. They're asking for a doctor to give them attention that doesn't even feel his own emotions or her emotions. Okay? They don't know about self-love, self-care. They're not allowed to. It's illegal. It's illegal for them. So now guess what? What do you think happens when you're showing all this attention to that arm that's not feeling good and it's saying, where are you? Where are you, girl? Where are you? There's 50 trillion cells here that came together as a community to give you a life. Where are you?
Yeah.
Okay? All right, what do you think?
I'm ready to get this shoulder in operation.
Okay, all right. Well, thank you. You go take a look at the stuff I asked you to do and give me a call if you'd like to do a show before I head off to do this training in Puerto Rico. Okay?
Okay, will do. Thank you.
You got this. Okay, everybody, I want to thank you for joining me. That was a Real People, Real Healing. And just know this, August the 6th, 7 o'clock Eastern Standard Time, I'm coming on for 3 hours, all your questions. If you want to come on and if you want to ask your questions on my platforms, do it. I'll get them on the iPad. If you want to send them to Restream, that's on the iPad. Or if you want to come on live on video and talk to me, and I will take as much time as you need, go to bhnuniversity.com where all our trainings and all our master classes for trainings are, and grab the Zoom link and come on at 7 o'clock Eastern Standard Time, August the 6th, which is Wednesday. And Dr. Sage Wolfe will be teaching a Wolfe Non-Surgical course in Toronto, and that will be in September. I'm not sure the date, guys, but I think it's around the second week of September. If you go to bhnuniversity.com, we already have 5 people in the course. So the course is going to happen. It's going to be a smaller one. It'll be at Magdalena's Clinic in Toronto. And then we will be doing here in Extapa, Zihuatanejo, we'll be doing a whole life health certified, which is for everybody in the world. If you want to crack the coconut and become your own practitioner, become the light for your family, or even if you're a practitioner right now, if I don't rock your socks by the 3rd day of this 9-day course, I'll give you your money back. How's that? I guarantee you I will. I mean, if you want to think a new way, if you want to bring your game up and understand something, I don't care. You could be anywhere. Just know this. We have taught even an 8-year-old child came to our whole life coach course. We have taught an 8-year-old child even in our Wolfe Non-Surgical. We have taught nurses. We have taught doctors. We've taught every type of person on the planet. And why? Because they're going to tell you something. The reason why doctors talk in Greek is they've got something to hide, and they know you don't speak Greek. Well, I'm not going to speak Greek to you. I'm going to speak at the level that an 8-year-old says, yes, 1 and 1 are 2, okay? And we got this, and you got this too. Remember something. They're coming for all of us, not just you, not just me, all of us. And the sooner that we learn that there is a God, but guess what? We were given the power to create. It's called an imagination. It's called creation, okay? And if you take a look behind me, you'll see we have our app. It's called bhnapp.com. It's the world's largest app. Please take a look at it and get it for free. Go track yourself. Go have fun with yourself. Learn how to love yourself. And the perfect day guide, if you can't afford $48 to get it delivered to your door, then guess what? Download it for free at pdgfree.com. And like I said, I'll be on next Wednesday for Heal Your Family, Heal Your Life. God bless everyone. I'm Dr. Daryl Wolfe, and understand something. I love you whether you even know me. God bless.
Stop pooping in your pelvis. It's time to let it go. Shake it like Elvis. Feel the funky flow. Don't let it weigh you down. It's time to take the stage. Free yourself from the chains of your digestion cage. The scoop on poop is the truth you need. Daily cleansing tea is the secret. See, don't drop your core on the floor, my friend. Let the rhythm move you till the very end. Oh! Rotten to the core, the way to be. Find your inner groove with the cleansing spree. Flush out the toxins, let your spirit rise. Feel the funky freedom in your thighs. The scoop on poop is the truth you need. Daily cleansing tea is the secret. See, don't drop your core on the floor, my friend. Let the rhythm move you till the very end. Let it out, let it flow, don't hold it back. A little funky movement keeps you on track. Shake those hips, let the toxins slide. Groove with the beat, let your soul collide. The scoop on poop is the truth you need. Daily cleansing tea is the secret.